Good morning. It is now March 14th, 2023. I'm Dr. Deuk and we're going to be performing a facet joint treatment on a patient who has actually had the Deuk laser disc repair done about 2 weeks ago, and he's got now facet joint pain on the right side, and we've localized it to L5-S1. It could be some contribution from L4-5, we're not entirely sure, but it looks like a 5-1. So we're going to be treating his L5-S1 facets with a Deuk plasma rhizotomy. Now, for those of you who know what facet joint pain is, it's pain that comes from an arthritic joint in the back called the facet joint. And he definitely has that. You could see it on his x-rays. All right, let's get started. So, you think between the two?
Yes.
Maybe cheating a little bit here. We're going to get started, okay? Our patient is sedated. Blood pressure looks good. Shot. All right. So the first one I'm going after, you can see it there, is the that's the L4-5. Show us the L4-5 facet joint. It's right there. Show us the L5-S1 facet joint. Yeah, right about there. So I believe this is L5-S1. It could be also L4-5. If we have to bring them back, we will bring them back for the L4-5 as well. But to me, clinically, this is L5-S1. Shot. So that's what we're going to be treating first. Show us the target just for the audience so they can see where we're aiming for. That's correct. Shot. So I've got to navigate to that spot using this needle. Shot. Almost there. I feel it. We're on the bone. That's where we want to be. That's really good right there. So we're going to give a little bit of numbing medicine to make it more comfortable for the patient. And then essentially we're going to perform a burn, which is how you do a rhizotomy best at this type of location. And that burn is going to be done with an electrocautery, surgical instrument that we use quite often. Hold on. All right, shot. Okay, it's a little lower than I want to be. And I have to navigate using the x-ray. Watch your hand, Luis. Shot. Got to navigate the tip of my probe to that location. Shot. And by the way, where his pain has been localized, like topographically on his body, it lines up with the L5-S1 facet. So far I'm feeling pretty good about the diagnosis. Shot. All right, we're pretty darn close to where we need to be. All right. Let's see where we are. All right, it's lower than I want to be. Shot. More medial than I want to be. And this is a process of just using the x-ray machine to navigate to the right spot. So I'm going to try to deaden the area where the nerve is supposed to be, okay? And that is in this little valley right where the tip is. You can actually see the tip on the x-ray. That is the exact spot where the pain nerve lives. And so I'm using my probe to move it around to make sure I get that spot, because this poor man is in a lot of pain from his facets. And a lot of people don't realize it, but after having your disc fixed, you can get facet joint pain. It's the most common secondary condition we see. Let's just see. Shot. All right. That should do that. And then we're going to go for the L5-S1 next. Sorry, the bottom. It's the S1 area, which is actually what?
No, I say nice.
Which is where the actual L5 dorsal ramus is. Show us the target. Luis, this is not put on properly. It was the wrong way. Shot? Yeah. Shot? So did you guys see the white arrow there where Jordan was putting the white arrow with a target?
Yes, we did.
Shot? It's that little valley right there. That's what I'm aiming for. And it just takes a little repositioning. That's perfect right there, and I can feel the bone. You always want to feel bone. You have to be on the bone. These nerves actually run quite literally on the surface of the bone, just above it, just above the periosteum, okay? So you want to be, when you're targeting and positioning your instruments, you want to go down to the bone, and you want to feel the bone with the tip of your instrument. If you're not feeling the bone, you're not in the right place. So just be careful. He has a high iliac crest. Shot. All right, so too low there. I'm going to go a little higher. Shot. And we have to get through the fascia. Shot. 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 It's interesting, his iliac crest is at the top, it's like pinching me over. It's coming too medial, so it's pushing my instrument medially when I want to be a little more lateral. Almost there. I'm going to try to open the fascia up a little bit. There we go. Hold on. Let's get a shot. I'm aiming for that little valley you can see on the x-ray. You guys see that? Shot.
Yes, we do.
Just above where I'm at. Shot. That's it, yeah. Perfect. Jordan has shown you with that little arrow shot. That's where the nerve runs, right in there. That's the nerve, the pain nerve for this facet joint. And I want to make sure that we deaden that nerve. All right, hold on. Let's see where we are here. Shot. Shot. And shot. That's pretty much perfect right there. And let's get a shot. I'm going to move my, go ahead, shot. And I can feel I'm right on the bone, right where I'm supposed to be. That's it. Let's hope that works. Good job, everyone. If it doesn't, we'll come back and do the 045. So, but we'll know right away in recovery. You know, from what I can tell, all of his pain he's been pointing to is all right here. So the 045 would be up here, and that's higher than where he's been pointing. So that's why I didn't think it needed to be done. Let's hope this is it. We'll find out soon enough. Thanks for watching. Any questions?
Yes, just one question from Lubisa. And they asked, what do you think about Bertollitis syndrome after narrowing of the interdiscal space? Is the fusion the solution?
Yeah, Bernoulli syndrome is where the transverse process of L5 interacts with the sacrum and the iliac bone. I really don't think it needs fusion at all. I would not do a fusion for that. If I were you, I would use the Deuk Spine Institute free MRI review. I don't think that's causing your problem, but I could be wrong. But if it is, you just do a rhizotomy like we just did now. You don't need a fusion. So first of all, the most likely cause of the pain is still the disc. And we can fix the disc with Deuk laser disc repair. The second most likely cause would be the facets, but you could get pain from this Bertagnolli syndrome. And we just do a rhizotomy like you just watched right now. That's so simple, so quick, so easy. There's no downtime. You can go back to work the next day, back to normal stuff the next day.
And that is it for questions.
Thank you. Fluoro time? All right, we can go ahead and sign off.